Welcome to This Week in Health IT News, where we take a look at the news that will impact health IT. This is another field report where we talk to leaders from health systems on the front lines. My name is Bill Russell, Healthcare CIO Coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. As you know, we've been producing a lot of shows over the last 3 weeks, and Series Healthcare has stepped up to sponsor and support This Week in Health IT. And I want to thank them for giving us the opportunity to capture and share the experience, stories, and wisdom of the industry during this crisis. If your system would like to participate in the field reports, it's really easy. Just shoot me an email at bill@thisweekinhealthit.com. Now, on to today's show. Today's conversation is with Phyllis Teater, the CIO at The Ohio State University Wexner Medical Center. Good morning, Phyllis. Thanks for joining the show.
Thank you. It's wonderful to be here, Bill.
Well, I really appreciate your time. I get emails from CIOs. There's just so much work going on right now. So we'll just get right to it. You know, give us a little background on your system, and then, if you can, a little context of what's going on in your community right now.
Great. So we're a large academic medical center, about 1,200 beds. And a very large outpatient volume here in Central Ohio. We are the provider for many of the high-end things, as you would expect from an academic, but we have another couple of large partners in the area who also provide care. And one of the things I'll talk about is our coordination with the other care providers in the community. We are very blessed to have a governor and a state structure that is being very forward-thinking and helping us prepare. And so, and to be able to work through the issues related to COVID. So we are still in a state where we are preparing for a surge that we do not expect still for a couple of weeks. So a lot of work going on getting that preparation all in place.
Yeah, we won't go down the political side, but your governor is getting a lot of kudos for getting in front of this, being aggressive, coordinating activities, and I think that's something that we will all take a look at after the fact to see how the state governments and federal and whatnot responded. All right. So what are the things you have discovered in the past few weeks that might benefit others as you're getting ready?
Well, probably the most amazing thing I've discovered is the ability of a large IT organization and a very large organization to move at speed that I never expected to see. We are a large, system with a lot of maybe bureaucracy sometimes. And I think that I have been amazed at our ability to set that aside and get some things done that that would normally take us months or years in a matter of days or weeks. And so I think that just that discovery is just incredible and amazes me that we kept turned on that dime. But now, of course, we've learned we can do things very quickly, which is wonderful.
Yeah.
Sorry.
No, please go ahead.
From a specifics perspective, we started shortly after things started to escalate. We started a daily communication with the whole IT department. And then probably a week later, added a section to that communication that is, we call on the lighter side, and has really helped, I think, our team to stay connected, people sharing personal stories, funny things that they've heard, cartoons, all sorts of things that has really helped our team, I think, to continue to try to stay as the family that we are.
Yeah, I've heard the word focus used a lot from CIOs. It's the pandemic has been had a focusing effect on health systems. Just everyone is laser focused on addressing this, so we're able to do things at speed and at scale that we had the capability of doing, but haven't really done up until this point. It's pretty amazing. What are some specific solutions that you've put in place that maybe others might benefit from?
So we have done, the two massive areas been a lot talked about are the work from home as well as the capability for telehealth. Those really have hit at the industry. All of those things were in progress, and as you spoke about, are amazingly how they were in progress. We had some capabilities, but our ability to take that to scale and ramp it up and get buy-in from our users is what has just changed dramatically. And so one of the things in that space that we helped with early on was to work really hard to get our call center people home and working from home, because we did not have that in some of the more critical areas like our transfer center and where we do bed placement and that kind of thing. And they have complex setups that are rough to do remote. So we did work through that and got them home, and that's allowed us to be prepared. We are doing something I think probably somewhat unusual here in Central Ohio, where we're doing a small cohort of individual people from each of the large health systems are being added to a single call line that will help us to place patients during a surge that we may see. And so they're all connected electronically to a single sort of hunt group, which is what they're called, for them to be able to take incoming calls, even though they're at 3 different institutions.
Wow. That's fantastic. Well, as the academic medical center, you had you probably had a sizable population at the time when this was starting to break. And obviously we've taken away the elective or non urgent surgeries and those kind of things. But are you doing something in the way of remote monitoring and care for those patients that you're not doing those surgeries for at this point?
So I think the in the inpatient environment, they still require such direct care that we're not doing. We're doing some things maybe differently, but still functions for those non-COVID patients much as it did before, and we're hoping to continue that. Although the volume is less, so we're working through that. For our outpatient environment, yes, we're doing a lot of things differently in terms of how we care for that patient population, because some of those visits are just as critical to keeping people healthy if they're struggling either with a chronic disease or with an acute issue that is non-COVID related. We still need to be able to serve that population in a quick and efficient way, but also in a new way in order to keep them safe. So if they need to come in person, they're seeing new processes and new policy types of things happening. But if they can be seen virtually, that's obviously the place that we really want to go, and have ramped up our visit volumes in a virtual way by a couple of orders of magnitude.
Yeah, the numbers I'm hearing are amazing. What's one of the things you've been really just amazed or impressed that your team's been able to accomplish?
So in 1 week, we stood up both a large for the organization, a large scale, very large scale outdoor drive-through tent based swabbing station, and wired all the connectivity and set that up. That kind of took off on a Monday. Wednesday morning, they were open. The same week, we started to put in place a plan to stand up a new lab, both physically as well as organizationally, that we partnered with another organization here in Columbus named Battelle, who is a very large, one of the largest research organizations in the United States, to stand up that lab and use some novel processes for testing. So we had a blank slate on Wednesday morning, and by Friday, it was outfitted with all the technology, all the build was underway in our Epic system to be able to do those tests. All the users had access and they were doing training. So in 3 days, we equipped a space and built all of the system things and added all of the users to be able to start doing our tests ourselves. And we are now the reference lab for Central Ohio. And the first test was done maybe a week and a half ago. So
Wow, that's fantastic. Do you have any solutions you're doing right now around PPE or just monitoring or putting that in place?
So, Battelle, again, as a wonderful partner and an amazing group of brilliant people, we for PPE we are across the street from Battelle Research Institute from their home office, and we are reprocessing PPE. So for N95 masks, we collect them, transport them to our partners at Battelle, and they are able to re-sterilize them and return them for use. And they think that the tests are showing that we could re-sterilize an N95 mask perhaps 20 times and use it before it is not usable.
Wow, that's fantastic. Anything in the prep process that you wish you had done earlier?
I think that understanding as we were making our plans for folks that there were things we should have ordered earlier because we are having some delays with some equipment that we would like to have had earlier. And the list would include some headsets. Those are in very short supply because we want to send people home that need a headset in order to do their work. The small wireless adapters that you can hook up to a desktop to be able to equip it to function wirelessly if you want to send somebody home with a desktop. So just always having that be the first time sort of an idea comes up to do something different. That should be one of the very first questions in this kind of situation is what might be some of the equipment, and let's get it on order now. Okay, now let's talk about the process and test it and those kind of things. So
yeah, that's amazing. Well, Phyllis, thank you very much for taking the time, and thanks for sharing your experience and your wisdom with us. I really appreciate it.
Thank you, Bill. Happy to do it, and I'm learning from the other field reports because I'm listening to those. So thank you very much for doing these.
That's all for this show. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email, DM, whatever you do. You can also follow us on social media, subscribe to our YouTube channel. There's a lot of different ways you can support us, but sharing it with a peer is the best. Please check back often as we will be dropping many more shows until we flatten the curve across the country. Thanks for listening. That's all for now.